With a new year, but the same problem, a record surge of new coronavirus cases. In fact, COVID cases setting records yesterday for both North and South Carolina. The Tar Heel State reporting more than 19,000 cases in one day alone, toppling Thursday's 18,000 cases. Several days this week, roughly 1 in 5 people who were tested got a positive result. South Carolina also reporting a record high daily case count, nearly 9,000 new infections confirmed in one day alone. Just Thursday, the Palmetto State reported more than 5,000 cases. And as those cases continue to surge across the Carolinas, demand for COVID tests continue to skyrocket. Health officials preparing for another busy week coming off of New Year's celebrations. The Mecklenburg County Health Department is hopeful their shipment of at-home tests will actually arrive in the next few days to help ease the strain on testing sites. WCNC Charlotte's Chloe Leschner explains just how accurate those tests are.
We're ringing in another year clouded by COVID. Omicron continuing to spread and put a strain on the healthcare system.
We have seen an enormous increase in the demand for testing in our community.
Mecklenburg County distributed more than 10,000 at-home tests in a month before completely running out. They're hopeful a new shipment will allow them to expand the number of public libraries where they're handing them out. But are those at-home rapid tests reliable?
They are not necessarily the best, and they tend to have some more false negatives,
which could be a problem for someone who's taking a cautionary test. But if you are showing symptoms and don't want to wait in line for hours, an at-home test could do the trick.
I would say if it says that you're positive, they're actually pretty accurate.
Incoming Mecklenburg County Health Director Dr. Raynard Washington says you don't necessarily need to get a PCR test to confirm it. At-home test results won't be reported to the county or state, but health officials are counting on people to follow CDC guidance so they're not spreading the virus to others.
In general, isolation or self-isolation is the first task and most important part of that, and making sure that you obviously, if you have severe symptoms, to deal with, to get in contact with your healthcare provider.
Chloe Leschner, WCNC Charlotte.